Hello everyone, my name is Lacey Hensel and this is my presentation for Capstone. My professor is Dr. Jill Alsman and this presentation will be about bedside shift report, the research on bedside shift report, and how it affects patient care. A problem in many healthcare settings revolves around poor communication between patients and nurses. Poor communication affects many aspects of patient care, including patient satisfaction. Today, around 27% of malpractice suits are caused from poor communication between staff and patients. 69% of clinical environments do not have a standardized shift report, policy, or procedure. It has been suggested that decreased patient satisfaction is caused by poor communication with nurses. Patients usually become dissatisfied with their care because they do not feel that they are involved in their care, understand their plan of care, their disease, medications, or treatment. Negative outcomes from decreased satisfaction involve patient, friends, and family upset with care, ineffective knowledge of treatment, and overall patient safety. For the first study, it was conducted in Brisbane, Australia on 2 geriatric and rehab units. The population was 125 patients. Instruments used for this study were Likert-type surveys to collect the data, and it was analyzed using Wilcoxon sign rank test. The intervention included implementing bedside shift report. Before report was done, surveys were conducted, and then after as well. There were 5 domains assessed. The first one, were you fully involved in the discussions between your nurse? Did you understand? If you didn't understand, do you feel like it was explained appropriately? Did you feel respected by your nurse, and did you get a chance to ask questions? After data analysis, all 5 domains revealed statistical significance. Some recommendations for the study included increasing the sample size, increasing the amount of staff involved, and attempts to avoid the Hawthorne effect. The second research article was conducted in a tertiary hospital on a postpartum unit. The population included 289 patients. 146 of those were pre-implementation and 143 were post-implementation. Instruments for this data collection that were used included HCAP scores, and this data was analyzed using Wilcoxon rank subtest. The intervention was implementation of bedside shift report. Findings showed an increase in satisfaction among Hispanics and those with public insurance. Recommendations included having a more diverse population and implementing a more extensive study design to better assess patient satisfaction. This third research article was conducted in Switzerland on a 96-bed general medical rehab ward. The population consisted of 180 patients. 90 of those were in the pre-implementation phase and 90 in the post-implementation phase. The intervention was bedside shift report. The Picker questionnaire was used to survey before and after implementation of the intervention. The data was then analyzed using chi-squared test and one-way ANOVA test. Findings were statistically significant for coordination of care and involvement of family and friends with p-values less than 0.05. The one-way ANOVA test showed a statistical significance for continuity and transition of care with a significant p-value of 0.020. Recommendations include a more diverse sample size and an attempt to avoid the Hawthorne effect. The fourth research project was conducted on a 5 adult inpatient med-surg units throughout the Midwestern United States. The population consisted of 103 patients surveyed day 2 or later of their stay. Instruments include surveys. The data was then analyzed using one-way ANOVA test, Pearson correlation, and post hoc analysis. The intervention was implementing bedside shift report, and the findings shown, patients who always experienced bedside shift report had significant and positive correlation with the perception that nurses who always conducted bedside shift report provided accurate information with a p-value less than 0.001. And nurses who said that they were going to do something did do what they said they would do with a p-value less than 0.008. And the fifth and final research project was conducted in 2 different units in a 149-bed community hospital. Med-surg consisted of 46 beds, and the obstetrics unit consisted of 12 beds, and these were the units that were studied. The population consisted of 290 subjects in the pre-implementation phase and 289 in the post-implementation phase. Instruments included Press Ganey surveys and HCAP surveys for data collection, and analysis conducted using sample t-tests to compare pre and post-implementation results. The intervention included educating the nurses on bedside shift report and then having these nurses implement it. Findings suggested on both units that nurse involvement and communication percentile rates improved, but p-values were greater than 0.05. So this does suggest clinical significance, but not statistical significance. Recommendations were to include a more diverse population. So my PICO question consists, the problem would be decreased patient satisfaction that influences many different factors of healthcare. The intervention would be implementing bedside shift report on med-surg units. We are comparing this to report that's given at the nurse's station or has been recorded. And the outcome would be improved patient satisfaction as measured by HCAP scores. Theoretical framework. The nursing and helping theory best represents this proposed research. This theory was created by Robert Karhoff. It consists of 4 different phases. The first phase is the attending phase, which is the introduction of members into a relationship. The second phase is the responding phase. Appropriate responses can be given in verbal and non-verbal communication. The third phase is personalizing. The patient agrees to specific goals that are set for their plan of care. And the fourth phase would be the initiating phase, in which bedside shift report is conducted for every interaction. This is applicable to this proposed research because the purpose of bedside shift report is to connect with one another and make a relationship. This theory promotes that communicating and respectful relationship among a nurse and a patient. For the proposed research, the design would be a quasi-experimental design. The method would be implementing bedside shift report on med-surg units. The setting would be rural hospitals. The sample would consist of roughly about 150 participants, 75 in the pre-implementation phase before bedside shift report is begun, and 75 in the post-implementation phase. For the selection of the patients, we want them to be 18 years of older, able to make their own decisions. They have to be alert and oriented and be able to answer the survey questions. And the patient must be admitted to the hospital for at least 1 night so they can experience morning bedside shift report and nighttime bedside shift report. For confidentiality and consent, education would be discussed with the patient about the project, and we do want them to sign consent. For data that would be collected, we would use HCAP scores and survey type questions. Actually, the HCAP surveys contain 19 core questions about the patient's experience. This is reliable because it's a standardized national survey that's used among many hospitals in the United States. For data analysis chi-square test, this would allow results from each specific survey question to be analyzed, and it has a 95% confidence interval. In conclusion, poor patient satisfaction affects many aspects of healthcare. Implementing bedside shift report can improve patient satisfaction and patient outcomes. This means better knowledge of disease, treatment, and medications, and decreased admissions, and overall promote the patient's health. And these are my references. Any of you would like a copy of them, I can get them to you. Any questions?
So what do you think the biggest barrier is to get nurses to
Actually do bedside shift report? I think the biggest barrier is depicting what information is too much information in front of the patient and really determining their knowledge level, which is something that should be assessed on the admission. Really making sure that patient knows why they're here, what their plan of care would be, so whenever the nurses go in there every morning and night shift bedside shift report, that they're not confusing the patient, and this person said that, and this person said this, what does it mean? Why am I here? What are we doing? So.
But I just feel like it's such an important thing for each nurse to validate, you know, how you dealt with the patient and how you're receiving the patient.
Yes.
And all of those things, so it'd be great.
I think it's something that we could all work on just to get better, especially relationships and communication with our patients.
Yes.
Any other questions? Well, thank you guys for coming.